What's going on, guys? Happy Tuesday. Welcome back to another episode of Eat, Train, Prosper. Today's going to be an update episode on Bryan and myself. We are going to do a little bit of a deep dive into our current training in nutrition and then a little bit of forecasting for what we are pretty much planning to do over the next 6 months or so. As always, we have some updates. Bryan, can you kick us off?
Yeah, we made it to San Diego. That's probably my biggest update. 3 days driving here. Went through Santa Fe, Scottsdale, and then finally to San Diego. And it was cool. I've never taken the southern route before. In the prior years, we've always taken the northern route, which takes us through Moab and then Vegas and then San Diego from there. So taking the southern route was pretty cool. Santa Fe was an interesting town at 7,300 foot vertical, so it's higher than Boulder is, and it was colder and snowier than Boulder. And then I had this idea in my brain for some reason that as soon as we left Santa Fe, it was going to be like a change in weather, and I was going to be warm for like our drive to Scottsdale. I was wrong because basically you are on this elevated plateau for that entire drive. So it was like 7 hours to Scottsdale. It didn't warm up until 6.5 hours in. Like literally, we're on the top of this plateau 6 hours later driving, and we're still at 7,000 foot vertical. Going through New Mexico and then Arizona, and Kim sitting there like, I didn't know Arizona was like this, and I was like, oh yeah, Arizona's got all sorts of crazy topography, but it really felt like we were just in the mountains the entire time, and then suddenly we descend down and we're in Scottsdale and it's like 65 degrees and sunny. So that was a little weird, but we made it, and that's awesome. The weather the first 2 days here has been great, and we spent a ton of time outside. I bought Bryson a bike, so we didn't actually bring his bike. I figured I would buy him one here because he was needing an upgrade anyways. He had this 14-inch wheel bike that he had been using, and he was way too small for him. So I got him a 20-inch bike, which is maybe slightly too big for him, but he took it for a spin, handled it like a boss, and it has gears. So literally, it's like the wildest thing. You have this 5-year-old kid who's all of 42 pounds, and he's on this 20-inch bike that has 7 gears, and he's like not even strong enough to change the gears. He can change the gears to make it harder, so he can go from like 1, 2, 3, 4, 5, 6, 7, but then he can't get it back from 7 to 6 to 5 to 4 to 3. So it's like it's actually a bit of a problem. But yeah, it's been cool, and I'm excited to go out and bike with him. However, the next 4 days are supposed to be rainy and in the 50s, like all day rain. And I think this may just be the remnants of this storm that's about to hit the rest of the country. So Boulder, Wisconsin, the whole Midwest is about to get crushed by a huge snowstorm, and I think it's just probably rain in San Diego. So that's what we're experiencing here. And then my hamstring's doing a lot better, so it's continuing to improve. I was able to do my single leg curls with 45 pounds this week, and it was 25 pounds last week. My strong leg is doing them with 75 pounds. So I went from like a third of the way there to 2/3 of the way there. And then hopefully next week or the week after, I can do the full thing. I'm still a little bit hesitant to try bilateral RDLs. I kind of want to just stick with single leg stuff as much as I can until the strength evens out, just so I avoid any sort of like compensation injuries under load and stuff like that. But I was even able to jog the other day, not like I went out purposefully to jog, but Bryson got a little too far ahead of me on his bike. And so I had to like jog after him a little bit. And I was pleasantly surprised to see that I could actually jog at like a slow pace, but definitely no sprinting in my future. That's for sure. Um, and then I did a double cardio day yesterday. So I had missed a number of training days through the trip out here because we left Thursday and then didn't train Friday, Saturday, or actually Sunday I did train. I was able to get to the gym, but basically 3 days of no training and no cardio. So yesterday I did zone 2 and then rested for 3 hours, got some food, and then did zone 5. So that was just a massive day of output. My Apple Watch, I set to 700 calories of expenditure as like my daily goal. And that in most cases is either 12,000 steps and no other exercise, or it's obviously some exercise and then fewer steps. But yesterday, my watch said I hit 1,600 calories of expenditure. So that's like the equivalent of probably 30,000 steps, or what I did was 12,000 steps and then a ton of actual exercise. So that was wild. I haven't done a day of that much energy output for a really long time and slept super well last night. Also, sea level is a wild thing, especially because I've spent the last year in elevation. I noticed two things with sea level. One, that my cardio output was way improved. I could maintain 140 plus beats per minute for my zone two, and it felt easier than when I maintain 135 beats per minute at elevation. And then I slept really well too. The last 2 nights of being at sea level, my sleep has been insane. I slept 6 hours unbroken last night before I woke up to go pee one time. And I don't think I've made 6 hours unbroken in years. I mean, literally years. So that's kind of wild too. Kind of makes me wonder if maybe sea level is like a better place to be, but that's definitely not something I'm going to do as far as moving or anything. It's just food for thought type thing. But anyway, I did get my blood work back. I was kind of talking about on the last episode how it just was never coming back. It finally came back. So I want to talk about that a bit. But before I do, I'm going to pass it over to Aaron and let him talk a little bit.
Yeah, the thought that not a thought, but follow up to the sea level comment. It's a what is it when there's a specific term for like when something is like brand new and then you get the like stimulus from it and then it kind of fades over time. I
Repeated
can't think.
bout effect, maybe.
Yeah, but it's like the longer you stay at sea level, you basically
Oh,
adapt
you
to
just
that
adapt to it and it
environment.
becomes normal.
Yeah,
Yeah, yeah.
I mean, because that's always happened to me. And then conversely, like when you go from sea level to like Denver for a week or Salt Lake or something like that, you're like, whoa, why am I getting my ass kicked like walking around? Why
Yeah,
is
I
my
mean,
sleep dog
I'm
shit?
not excited to go back to Boulder and have to deal with that readaptation to the elevation again. That's going to be
Yeah.
gnarly.
When we were in 2021 living in Salt Lake and then went to Scottsdale. Right after that, we went hiking like the second day we got in, and I was like, why is this so easy? It was like crushing it. My heart rate was like super low. I was like barely breathing hard. And I was like, oh, yeah, we just came from altitude. Right. And then within like 2 weeks, I was a regular ass person again, unfortunately.
Yeah, well, I have that to look forward to.
Some updates on me. Knee is doing so much better. Again, what I was hoping for would happen. There were still times where I would like have to laterally step gingerly. A really good example is like moving heavier dumbbells would be a very cautious, very non-natural movement sort of thing. Excuse me. And this has been kind of faded away, and it does feel pretty good now. I barely noticeable. I was able to push the hack squat, which was my first week on a new hack squat, quite hard. There was like I could feel a tension in that knee area at the very bottom of like a fully lengthened quad. But as how I perform my hack squats, very slow, controlled, eccentric, a pause in the bottom. There's no like quick rebounding off of tendons or anything like that, and it felt really good. So I am happy. The knee is damn near about 100%.
That's
Um,
awesome.
yeah, I'm very excited about it. I am also officially at a new gym. One of the new gyms had their like grand opening. All of the every piece of equipment is in except the leg extension, which leads me into my next kind of note here. I was really interested to see like, okay, I don't have a leg extension, but I have like I'm going to modify some things in my programming, and let's see like, can I put together a really stimulative of a quad session without the leg extension, so without training that kind of fully shortened position, um, and with the hack squat and the leg press essentially there. The hack squat is good. It's not great. It is one where there's like a big gap. Like we have, okay, for everyone watching on YouTube, we have actually the angle of the sled, but the foot plate doesn't meet at the bottom. The foot plate
Mm.
starts like up here. So this is just like open air there, and there's only so low you can put your feet. And what happens is then to get like the very full range of motion, you're actually getting less knee flexion, and your knee actually rotates back into, I
Hmm.
guess, what would be extension slightly, and you're getting that final ROM at hip flexion.
Yeah.
Um, so I was able to get like a good quad stimulus out of that, not as good as I could on the previous hack where I had full knee flexion, the entire like maximum knee flexion. Um, and then the leg press, of course, doesn't go to depth. And I was like, okay, well, I'm just going to do like dead stop, lower it to the very, very bottom, and then dead stop. The hard thing there is that just becomes a very, very hip dominant. So I took
Hmm.
those essentially to failure. I actually did fail one of them, pushed that as hard as I could. Um, and then I was like, okay, I'm going to see. And from that, I'm like, I have my third exercise would generally be the leg extensions. And I was like, I could go do like sissy squats, but I was like, I don't really want to put my knee under the sissy squat strain right now. It's like just feeling good. I don't want to push it. But the answer was like, no, I couldn't get as good of a quad stimulus. And now, it's Wednesday morning for me here. Wednesday is when I would find my quads would be like most sore and my weight would spike the most from the inflammation. And that happened to a much less notable degree. So I was kind of had to answer my question like, does the kind of equipment, the options the equipment give you, like, is that a degree of does that play a role in how good of a stimulus you can get, sort of thing? Because that's something that I've always kind of thought was like for years, I trained super hard, but I could never get that like quad pump or stimulus that I was looking for. Like, how much does equipment play a role in that? Now, knowing the information I have, like I would fair to say it does play a significant degree. Those final few angles in
Hmm.
ranges do make a difference, in my opinion.
Yeah, well, I mean, especially considering that the rec fem is the largest quad muscle and it runs right up the middle of your thigh. And so leg press and hack squat are both going to train a little bit more of the other three quad heads and probably not the rec fem. And so, yeah, I guess like my suggestion was going to be the sissy squat or like the reverse Nordic. But if your knee isn't feeling up to it, then you just kind of have to wait on that. I'm pretty sure you're not going to have any rec fem shrinkage for like a couple weeks, but over the course of time, like to improve the quality and get like a more thorough, complete quad session, you do probably want to figure out a way to train that until the machine arrives.
Yeah, I was told like 2 weeks. So it'll be at most probably 3 sessions. Hopefully by next week, my knee will feel even better, and I'll probably just do a body weight, of course, a body weight sissy squat set or two to kind of polish that off. But it was a kind of a little bit eye opening for me there because I went
Yeah,
in
that's
with
cool.
like, what can I do to like make this as good?
Hmm.
I tried, and like it does really matter when you can get like a hack squat that allows you to put your heels, right up against your butt and those sorts of things. Like, it is a notable degree of difference.
Yeah, I guess the other thing you could do is hook up an ankle cuff and do like a cable leg extension. I mean, that kind of sounds like a lot of work, but
Yeah, yeah. But for updates for me, I think that's about it.
cool. Well, regarding my blood work, it finally came back. I was bitching about this on the last episode because it took a full 2 weeks, and their website legit says 5 to 7 days. So I'm like this anal guy, emailing them like, "Hey, blood work's still not here. Come on, where's my blood work?" I'm sure they hate me, but eventually I got the blood work, and so overall, I think it's mostly a lot of positive. There are a few things that I'm curious about and wonder if you have any input because they're not things that usually are something that I generally find myself looking at as like, you always have those 5 or 6 things that you look at and you're like, these are the things that matter. And now there's these other things that I'm not sure how much they matter. So one interesting piece is the last 3 years of blood tests that I've done, my total T has been under 300 on every single test the entire time. It's been between 260 and 280 every time, regardless of dieting or surplus or whatever. This time it was 450. So the only thing that I can say has been really different this time around is that I started mouth taping and breathing through my nose at night. And that is apparently something that can happen when you start getting higher quality sleep. T levels could go up. So I find that interesting. But one interesting piece about that is that my free T did not go up. And at least what I hear from Peter Attia, who's kind of the guy I follow on a lot of this blood work stuff, he said that in his clinic, they only look at free T. They don't even care about total T at all. They only look at free T. And so my free T was at the very, very bottom of the range. The range is like 8 to 25 or something like that. And mine was like 8.5. So it was like right there. But aside from that, like the total T being higher is seems like a positive at least. And then the ones that I'm kind of curious about and don't really know what to think of, my DHEA sulfate is above the reference range for the first time. I looked back at all my other blood works and it was always in the 300s. And this time it came back at 560, which is like 200 points above where it was in prior blood tests. So I don't know. Do you have any thoughts on DHEAS? I looked it up online and it seems like it's an effect of adrenal glands, and it could be a sign of having a tumor on your adrenal glands. But of course, Google loves to scare you.
Yeah, of course. Google definitely loves to scare you. So DHEA sulfate is like your usable form. So we have like a DHEA and then sulfate is kind of like the active form. And that is essentially like an upstream hormone to testosterone. So sometimes what people will do is like when we have lower testosterone, especially if DHEA is low, you can like, some people say you can like supplement DHEA sulfate to help kind of encourage the testosterone. This would be a total to come up. So that, in my opinion, is probably why the testosterone is up to a notable degree. Because it's not like we're talking about, oh like your testosterone will vary within like your ranges, especially as you get more and more blood work. Like mine is generally 560 to like a 610. That like I am always in that range. Yours damn near doubled.
Right.
So from that, the DHEA being that high, the DHEA is in not corroboration, but what is like a production of the adrenal gland sort of thing. So that one, it would be interesting to see where the fasting cortisol was as well.
Where what was?
Your fasting cortisol, the cortisol serum cortisol marker, which I'm sure we could get into.
Yeah.
From my standpoint, when you said, "Hey, my total T is doing a lot," it's into the reference range now. The first two things that came to my mind is like Bryan started sleeping better and he stopped smoking weed daily for the first time in 20 years, so sort of thing. So I'm interested just to hear a little bit more as we talk about the blood work and kind of thoughts around that as well.
Cool. No, I agree. I mean, I actually, the smoking weed thing is one that I actually didn't think of as a product of why the tea was better, because I'm still doing weed. I'm just not smoking it. So like the substance is still getting into my body, but maybe the smoking itself does have an effect as well. My fasting cortisol, I just checked, is 9.9. So I don't know what that means as far as DHEAS.
Yeah, not super high, not super low, but generally in a perfect world, a little bit like around like a 12 to 15, especially with getting that taken in the morning, is what I would consider like an optimal. But other lifestyle things to look at, like if you seem like a very kind of mellow, even keeled person to me, I don't anticipate like a very, excuse me, like a much higher stress period of your life or a significantly like lull of a stress period in your life. But it does look like that whatever mechanism could it have impacted that DHEA would likely also be correlative to that total testosterone increase.
Interesting.
With the free testosterone, where was your sex hormone binding globulin or albumin notably high?
So albumin was 4.7 last test that I did, and this time it was 4.9, so just
Okay,
slightly
so
higher.
yeah, not a notable difference, I would say.
As far as globulin, you keep kind of breaking up on me, and your picture's off right now, so I don't know if it's an internet issue or what. But my globulin was 2.0.
Sex hormone binding globulin.
Yeah, I didn't get SHBG on this test. That's one that you have to add on separately, and so I don't know what it is currently. I added it on last year, but I don't have it now.
Okay, yeah, that one is where a good majority of total testosterone will be bound to. So if that came back considerably high, that could be why the free testosterone is a little bit lower. And just to share anecdote, my personal sex hormone binding globulin tends to run high, and I generally will have, right on the cusp of clinically low free testosterone on my lab work.
Interesting. So the other one that I was super curious about on mine is, so my estradiol is still in range. It was in range last time too. So last time I got my blood work done, it was an 8, and this time it's 30. So literally my estradiol went up like 3.5 times.
Yeah, I wouldn't say that's not necessarily bad. Estradiol, like 40, 42, 45, something like that is kind of like the top end of the reference range there for
Yeah,
estradiol for men.
correct.
Important distinction there for men. Um, and the thing with testosterone to estrogen is we want them to exist in a relationship. Like the higher testosterone you have, the higher estrogen you're generally going to have. As males, we make our estrogen via the aromatase enzyme, the aromatization pathway. We aromatize testosterone into estrogen. So if you have just more total testosterone, you are generally going to aromatize more. Some of the considerations where it might get too high are too high of body fat percentage levels. So if you're like, let's say, like as a male, pushing 25%, plus you're generally going to have generalizations, right? It's always going to be different in like a one-to-one kind of context, but generally higher estrogens because the adipose has more estrogen receptors there. The adipose tissue has more estrogen receptors. So I really wouldn't be concerned with that. The first thing, like when estrogen is too high, you will probably start getting personal symptoms. You might get like the itchy nipples, a little bit more emotional, more anxiety, those things that are correlative with higher estrogens. But again, in natural contexts where we're not exogenously modifying our hormones, outside of like maybe some issues and stuff with like puberty, it's very not common at like a gen pop fitness person level.
Cool. Yeah, I figured it was probably better that I had it more in like the mid part of the range than at 8, where it was like the very dead bottom of the range. So yeah, that was just one interesting thing. And then the last one, and this one I'm like kind of concerned with, is so my fasting insulin is always low. It always comes back at like 2.5 or 3.0. But this time they flagged it because it was so low, it was out of the reference range. So my fasting insulin was 0.9.
That is low. That will commonly happen with me as well. What was the fasting glucose and HbA1c?
HbA1c was 5.4,
Okay.
and fasting glucose was 90.
Okay, so the interesting thing here is like too low of insulin is a very not common kind of problem, because insulin basically keeps your glucose and HbA1c in check, right? And kind of what like the term insulin resistance that so many people have, I'm sure, heard of at this point is like your pancreas keeps producing more and more insulin to keep the HbA1c and glucose in check. So if that was like higher insulin is worse than lower insulin, and what it really is your body's just not deciding that it needs to produce that much insulin to keep the fasting glucose, at a lower level. This, if I'm being honest, this is the crux of my own personal vendetta with my health. My body does not produce a lot of insulin. Whether that's going to be develop complications of like a type 2 diabetes sort of thing. Potentially, I have a lot of it in my family, but no matter what I do, my insulin production is quite low, and my fasting glucose is normally high 90s, low 100s, and my HbA1c teeters right under the pre-diabetes, right under the cusp of pre-diabetes, but it just doesn't change. Right? I mean, I've been through all the modalities. I've been on metformin for a couple months, and it just doesn't really change. So I wouldn't
Yeah.
say it's too much of a concern, but if it just keep a check on like the glucose and stuff is the first place I would start looking for that.
Yeah. I feel like I may be due for an OGTT at some point just to kind of like get the full picture on this thing.
I mean, honestly, what I would say, there's two companies that I know of. Levels is one, NutriSense is the other one. That's the one I actually did. If you really want to know what your body's doing with your glucose and stuff, just get a CGM, continuous glucose monitor, pay for one.
Yeah.
If I remember correctly, with NutriSense, you could do a 2-week option. When I was looking at doing this, the Levels company was like still kind of in beta. They may have gotten out of that. But basically, you pop the CGM on the back of your tricep. It pairs to an app on your phone, and you get like, well, it's not essentially real time. It actually has about like a 30-minute lag of continuous glucose monitoring. And what's cool there is you can see what happens during your sleep, fasting, and then you get the like most important information is how do you respond to meals, right? Like what is your postprandial levels? Are they, I mean, obviously when carbs go up,
Right.
especially with how you have like your Gatorade and those sorts of, more liquid carbohydrate in the morning, they're going to go up kind of, but then how quickly are they coming back down to baseline? What is your average baseline throughout the
Right.
day? That, I mean, honestly, that's what I would recommend for anyone. That
Yeah, I think
really
that's
helped
probably going to be
me.
my first step. Oh, yeah, I think that's
Go ahead.
probably going to be my first step, but I've heard Atia talk so much about the OGTT, and he said that whenever he gets a new patient in his clinic, that is the first thing they do because like it will tell you even more than the CGM. And he even cited some case studies where he said he had somebody on a CGM and the standard deviation was like 15. So it never went up like super high or down super low. It just kind of hung out between like 85 and 115 or whatever. And he said then this person, like they still weren't finding the answer from that. And so they did a OGTT and found that like they just weren't clearing the glucose at all. And like 2 hours later, it was still at like 170 or something crazy like that.
Yeah, I mean, I think I'm a big fan of testing and stuff, and it,
Yeah.
especially like obviously you're healthy, Brian, and those sort of things, but you want to know like what's going on with yourself, and it's almost kind of like a hobby sort of thing, like health, my own health
Yeah.
as a hobby.
Yeah.
Yeah, I'm all for it, and then we can talk about
Yeah.
it on the podcast.
So you had some blood work too. Yeah, for
Yeah,
sure.
so
Do you have any insights on yours?
yeah, I have I've known for a while, like I don't have good lipids. Well, I don't have good LDL lipids. Like my HDL is always well above 40, generally in the like 80 to 90 range. My triglycerides are always well below 100 as well, but my LDL has always just been high. I don't think I've ever seen it below 100 on a set of labs. So that's always kind of like been in the back of my mind. I'm like, okay, it is what it is. It's not like a huge thing, but I also was like, being more flexible with my nutrition in the past. I would have higher fat days and that sort of thing. It was never too much of a concern. I got an APOB done recently, and that came in at like a 99. I think the reference interval that I saw here was like a 40 to like a 130, and then kind of once you get above that like 130 is where that is getting a little bit higher. Now, granted, that reference range is off of Indonesian labs, which is where I got that done here. And if I remember correctly, Brian, you had an APOB done recently, and it was like 50.
Yeah, so from what yeah, it was 54. From what I understand from Atia is he said he wants all his patients under 30, which is like basically he puts them on a statin if they're above 30 as they age. So obviously, we're not at a point right now where I don't think it's that risky, but yeah, I mean, he even has himself on a statin because his ApoB was above 30 and he's 50 years old now. So I don't know how I feel about that whole thing of using medication and longevity and all that, but yeah, that's his thing. And he said the reference range in America is under 90, and then anything over 90 is risk.
Okay. So yeah, that would put me in that risk category. And then I was listening to something, I can't remember exactly what it was, but we have another kind of the landscape of the lipids and cholesterol sort of conversation in Western medicine is starting to, I think, shift away from just pure LDL, HDL sort of thing. We have, new markers like the ApoB. Another one is lipoprotein A, often spoken about as like LP
Yep.
little a, which is kind of like a genetic independent marker. So I was like looking for that. I found it. I was like, well, it was an expensive test. I was like, I'm only going to run it once. So sure, I'll add it. And that came back very not good. That was like a 95.4. And the reference range
And
was
what's
like
the range on that?
anything over 30 is like bad. And I'm like triple that. I was like, fucking sick. So that's been a little bit of like an eye-opening thing for me. And what's frustrating is when you look at when you read research on this stuff, when you look at guidance, it's like, okay, you have your lipids aren't great, like stop alcohol, stop smoking, like get exercise, eat better, sleep well. Like what do you do when like it's kind of like a joke, but like that is my life. My life doesn't exist outside of those things. Like I don't smoke. I haven't had alcohol in over 3 years, right? Like training, fitness, nutrition, like taking care of myself is my life. Like what do you do when you already do all those things? So that's where I've been like this week and now looking into a little bit more of things of like kind of more preventative kind of sort of things of like, okay, what does endothelial function actually look like, right? Blood pressure, those sorts of things. I may have these, unfortunate genetic kind of predispositions, but we know the like, what is it called? The genetic versus like epigenetic thing. Like I might have not great genetics on the kind of
Epigenetics.
yeah on, but does that mean that like the risk is actually there, or like what is the relativity of the risk? Like I've had the conversation with my dad, like his lipids aren't great. He's actually like a textbook type 2 diabetic, but my dad's 6'2", 180 pounds, like not remotely overweight whatsoever, been in the gym his entire life. And now it's kind of interesting when you're finding yourself kind of outside the standard deviations of what a lot of the information is on, and then who do you go to talk to around like, hey, I think I'm like an outlier or something, but like how do I know? And or is it like in the back of my mind, am I just kind of waiting for a heart attack sort of thing? Kind of like what was that dude? Fuck.
Yeah, I mean,
Bob
that's
Harper,
obviously very
the biggest
disconcerting.
loser guy. Yeah, the Bob Harper, the biggest loser, like coach who was like, fitness is life, and at like 52 in the gym, heart attack sort of thing. So that one has been kind of in the back of my mind. And then unfortunately at a time like this, like I'm in Bali where I can't go get a lot of this, not preventative, but like proactive testing done. So that's kind of my next step is like, okay, let's check like endothelial function, blood pressure. If I have like nitric oxide, if all of these things look really good, is it purely just hey, you have some unfavorable genetics in the lipids department, but as long as you continue living the lifestyle that you currently do, it's very unlikely that that will actually become an event. Or hey, enjoy your life, but 50s hit, you might check out sort of thing. I'm not sure.
Yeah, dude. I'm not really sure how I would feel about that. I mean, I know even looking at markers that I see that are not even as significant as that, and I'm like, fucking DHEAS is elevated. Like maybe there's an adrenal problem. Like it seems kind of like small potatoes in comparison. But like from what I learned about all the zone 2 stuff, like that literally is kind of what zone 2 does, is improve lipid function and glucose and all the things that go into metabolic function, right? And so maybe you just need to start actually doing some like concerted zone 2, like 3 days a week, get on a bike and pound away for 75 minutes or something.
Yeah. I mean, that's another thing too. I think with it's hard right now because of my primary goal of like increasing body weight. But that is another one that we're gonna, I guess, talk. We can shift the podcast into this now. Is like I may be finding myself at a point where like pushing body weight for the sake of hypertrophy may be a behind me sort of thing because of the. I mean, I've done it for literally my entire adult life. I haven't really spent much time ever in a calorie deficit. If we're totaling up like Aaron at 16 years plus, I've maybe spent 12, 18 months in a deficit of over 15 years. You know what I mean? Um, and I think it's just a lot of like pushing that mTOR pathway so much. And what we know about like longevity and stuff is it's not ideal for that. So it might be one of those things where I shift into like 195 pounds, whatever, maybe a little bit lighter, and I stay lean, and that is what it is, sort of thing. And then I do more like cardio and that sort of thing because what I to put that cardio in now, knowing how much I have to eat just to slowly build where I'm at, I don't want to have to be decreasing food quality just for the sake of getting more calories in to continue playing that out
Right.
and in game. You know what I mean?
Yeah. No, and I mean, we know the correlation between like higher body weights and elevated lipids and glucose sensitivity issues and things like that. So, like, I'd be really curious what happens to the like LP little a and the ApoB if you were to get to like 185 and just hang out there.
Yeah, I mean, I think it. Yeah, I don't know. I do not know, and I don't want to know. um,
Yeah. No, and you hate getting under 190. You're like, I just
I
feel so
know,
small under
I
190.
know, I do, I do. But yeah, but that'll be like the next kind of phase of that testing and seeing things. And then, I mean, I've even thought of the hard thing is for me is who to have these conversations with. Right? I know with some of these things that I'm talking about, like I'm kind of breaching the scope of where I feel very confident, but my trust in a finding trust in someone who I think is going to give me decent information is limited. I've had numerous poor experiences with like just your general MDs that like your insurance company's like, oh, this is your person in network, this is your doctor, and they're just like not fucking helpful. So I'm hesitant
Right.
to go like down a traditional pathway, but I've even like a consideration like we know elevated glucose in HbA1c for the longer it goes on isn't beneficial. Um, but like when your body just doesn't produce a lot, or maybe my body just likes to keep it there. But like I've even had the conversation like, would going on small amounts of exogenous insulin be beneficial for me? Right? Of pushing those down a little bit into a more appropriate range. Like, but who do I talk to about that? You have like your bodybuilding dudes sort of thing, but that's not necessarily from like a health standpoint. I want to find the like kind of bridge of that, and I just really haven't yet.
Yeah, dude, I was literally like just thinking that today because I was just looking at my my blood work results, and I was like, who can I talk to about this that like really knows it at such a deep level that I trust? And the only one, like, because I've learned a lot of this stuff from Peter Attia, I like think of him as the the figure that I would like to have represent me, but it's like $100,000 to get into his clinic and see him. So that's like not going to happen. But I don't know where to go from there. Like, I don't know what the like next level down is, So I'm right with you. If you find it, let me know. I'll let you know.
Yeah, I will. I think we're in a really interesting place in the landscape of Western medicine. Let's call it that, where some really what I will call really good, right? Take that with however you may. people are breaking away from the traditional insurance model and moving to like a private model. So there's someone, Kyle Gillette, who's been on the Huberman Lab podcast quite regularly, who's like he's younger, right? Let's say maybe 40, 44, 45, and in between, like probably like 35 and 45, somewhere in there. He's like pretty dialed into like the more health focused side of things, but also like a med school licensed, that whole thing. And he's someone that like you go see him, you pay out of pocket. Like there is no insurance model sort of thing. And that's someone that I think could be a great resource to look into. And for any of the listeners that are interested in, just keeping a closer ear to the ground of some of this stuff, that would be fantastic. But that's personally what I am looking at a lot more myself. And I'm finding more of the same with like my clients and stuff, right? Some clients will come back and they'll have like labs that are off. Like maybe MCH is really, really off, or like we have elevated or super low, like red blood cell count, white blood cell count. I'm like, hey, this is outside of like thyroid, sex hormones, lipid sort of stuff. Like you need to go see a doctor. And I'm like, well, my doctor's shit. Who do I go see? I'm like, I don't fucking know. But
right.
I'm having that conversation like more and more. And I think there's a trend moving towards where like people don't trust the traditional system that we've had for however long, sort of thing.
Yeah, I think what I need somebody that has all the knowledge of the MD, of like the hormones and the inner workings of the body and what each specific blood marker is on like a bigger picture. But I need this person to also be into fitness and like understand fitness, so that something like creatinine being elevated doesn't make them say, hey, do you have kidney problems, young man? And I'm like, no, I'm fucking on creatine.
Yeah, it's someone that understands like, okay, you have a lot more muscle mass than the people that the population is, or the population that the markers are produced from. Like your creatinine is going to be elevated, sort of thing, right? They're like, oh, hey, watch the carbs, and you're like, listen, asshole. Like that's when I first went into like my glucose concerns, I had my fasting morning glucose for like 3 months, on this spreadsheet, every macronutrient, everything that I've eaten. And he was like, you got to watch the carbs. And he was like, and Gatorade has carbs in it too. And I was like, I'm wasting my fucking time.
Right.
Here.
Exactly.
Like I waited 3 weeks to come have this conversation that I'm only going to get like 12 minutes with you, and I'm wasting my fucking time. And that was like the start of it for me. And then I had a few more bad ones, and I was like, okay, this is something I'm going to have to figure out on my own through PubMed and all sorts of different resources there.
Yeah, for sure. I mean, at least we are capable of doing our own research as well, so that's always good.
As always, guys, thank you for listening. This was a fun one. Hopefully it was informative for you guys to see that things with Bryan and myself aren't always perfect from a lab marker. And we'll handle any questions and further conversations on it in future episodes. So talk to you guys soon.